Meantime, let's get back to this. Our top story this morning, a health alert as the second case of mumps is diagnosed in the East Valley, and the cases here are connected.
Kind of gives you an idea of how contagious this is as well. New this morning, we are getting more answers from top health officials about what we all need to be watching out for. Our Nohelani Graf live at Hamilton High School. It's a small outbreak, but that's where this is focused.
Yeah, so Nohe, if your kids have been vaccinated, are they safe? That's the question this morning.
So I'm getting new answers for the Centers for Disease Control this morning, and they're saying, well, you are less likely to contract it if you've been vaccinated. You could still contract the mumps because that vaccine is only 80% effective. Now, by the time kids come to high school, they should have had that measles, mumps, rubella, that MMR vaccine twice already. So, but of course, Arizona makes exceptions for religious beliefs. We do know that the second patient is an adult who does not work at the school, and they were traveling with that student from Hamilton High abroad when both were infected. Dr. Rebecca Sonnenschein with the CDC says most mumps cases are associated with travel, so that's why you really need to pay attention to your vaccines if you're heading out of country.
There's a lot of issues with vaccination in other countries, and when you travel overseas, that's when you're most likely to get exposed to these diseases. So those individuals are at much higher risk.
So things to watch for: if you get a fever, achiness, and then a couple days later it's followed by that classic swelling of the throat glands, either on one or both sides, that's when you need to call your doctor for instructions first. And certainly if it's your student, do not send them to school. Kaylee.
That's great advice, and thank you for that information, Nohe. Let's talk more about this. The mumps are preventable with the MMR vaccine. The CDC recommending children get 2 doses of that vaccine, the first between 12 and 15 months of age, and again between 4 and 6 years old. Teenagers and adults should be up to date on the vaccination.